I'm Sarina Fazan, taking a risk, making a difference, and changing the course of your life. Remarkable stories from people defying the odds. You're listening to On the Record. Hi everyone, I'm Sarina Fazan, and thank you so much for joining us. I am so excited to have one of my favorite people here, Dr. Jill Hechtman. I thought I was so special that I got to call you Dr. Jill, but everybody calls you Dr. Jill.
You are special though, so it's okay.
Yeah. Well, you are our Dr. Oz in Tampa.
Thank you.
Dr. Jill. So first of all, introduce yourself. Tell us who you are. She's an OBGYN, but tell us about you.
I'm Dr. Jill Hechtman, and I work in Tampa, Florida. I've been here for 16 years as the medical director of my practice, which is Tampa Obstetrics, and I basically do it all. See any patients between pediatrics all the way to older women, and my fondness is for obstetrics, so I'm frequently at the hospital taking care of the OB patients.
I know, and constantly on call too, but I have to tell you how much I appreciate you, because as a journalist, so many times when I had any type of story, Dr. Jill, can you help me find a patient? Dr. Jill, you always come through, so I appreciate it. And now you're coming through for us as an expert, because I have lots of questions to ask you. Were you going to say something though? Did I interrupt? I'm sorry.
No, I'm happy to be here. And I think that one of the greatest people ask me, well, why do you like going on TV and talking on TV? And the truth of the matter is, it's an opportunity for me to reach a bunch of people as opposed to the 20, 25 patients I see in my office. So if I can spread the good word about medicine, I'd rather do it. And that's why I've chosen to kind of go the media route.
Well, and we appreciate it. And I know a lot of people have a lot of questions. And the first question I wanted to ask you, and I wanted to, of course, go into babies. Okay. But the first question I really want to ask you, though, is about the mask. I see that you have your mask.
So I took the mask down, as you know, because I want people to be able to look at my lips and see my face in complete entirety. But I am a huge advocate for wearing masks. And so follow the guidelines, follow the recommendations. You really should be using a mask when in public in front of others. Can you
talk about that more, though, Dr. Jill, because I get a lot of questions from people that say, why isn't it important to wear a mask?
Okay, so what the mask does is it protects you from me. So as I have my mask up, I'm basically preventing the spread of the virus by blocking it. Okay, and so it's not protecting necessarily me. It might have some benefit, but we're really trying to protect others. And that's kind of the main reason you wear the mask. What I'm finding though is so many people, like you said, they have all these questions, and I'm not really sure why that is. Why are we questioning the scientists? We're all saying the same thing at this point. Now, I know in the beginning, we were a little confusing, and I think that's why there's such a discrepancy. Like if you read your Facebook feed, half of my friends are pro-mask, half are against mask, and I think that comes down to the beginning and Dr. Fauci admitted this, that he didn't recommend mask coverings for everyone because he was trying to save them for the doctors and the nurses at the hospital. But in fairness and in truth, we should have been wearing masks from the beginning. So now that we know that that's the best practice, we need to keep wearing masks.
So let me ask you then about the mask. Like I see there, and I know you're constantly going in and out of the doctor.
Ineffective. It needs to be on.
And
cover your nose and your mouth.
But you're doing this. We want to see your face,
yes.
And we want you to be able to communicate because your message is so important. And we are sitting apart. So
we are 6 feet apart.
But with the mask advice, so if you have the paper masks or the disposable masks, how often do you need to dispose of your mask? Is it every time you wear it? And if you have a cloth mask, do you wash your mask? I mean, can you just give us some basic guidelines on that?
So when I get to the hospital, because we are trying to conserve masks, I usually wear one of these masks all day long. Okay. Obviously, if I'm taking care of a patient with COVID, I'm using different protection. I'm using the N95 mask, and usually this on top of my N95 to keep my N95 clean. So we are carrying it from the day. Your cloth mask, same thing. I would keep it in your car, keep it in your purse, put it on whenever you get out of your car to go into somewhere, and then wash it daily.
Wash it daily?
Yes.
Okay. So I wanted to also ask you this. So Sammy, my daughter, my 13-year-old, the love of my life. And I know you have one child too.
14, love of my life.
Love of your life. So we were someplace, and a man took off his mask to sneeze because he had to sneeze. I mean, he didn't sneeze he didn't sneeze on someone's face. He didn't, but he sneezed, and someone got really upset that he did that. But when you have to sneeze, do you sneeze in your mask?
Yes.
Or? Okay.
Yes.
Okay.
Cough, sneeze. I mean, before COVID, we would always teach kids, cough in your elbow or sneeze in your elbow. And that kind of blocked all of the spray of what's coming out of your nose. And if you're infected, obviously that could be a problem. So his philosophy was wrong.
Okay.
He should have left his mask on and sneezed, or if he needed to grab like a hanky and sneeze in the hanky, but you definitely don't want to just sneeze.
Okay, because I do think he did. I did not see it. He tried to turn away, and someone got upset with him.
There is some mask shaming going on, and I don't love that. I would much rather see mask leadership. So looking to people like myself, looking to people on the news who are making the recommendations and following suit so that people want to just emulate what I'm doing instead of saying, getting on to them, giving them a hard time about putting their mask on.
But once again, definitely wear the mask.
1000% wear the mask. It is going to help slow the spread of this infection. And really and truthfully, Sarina, and not to be dramatic, but it's all we've got right now, right? There's no vaccine, there's no prevention, there's no treatment completely. And so we got to do what we can to try to prevent the spread. And I do believe that masks help prevent the spread. So
speaking of the vaccine, do you want to comment on that? I mean, I know we have researchers working around the clock. We have amazing doctors in the world. Are you optimistic that
I am? I think that we'll eventually get one, but I don't think we're close. And because we're not close, that's why I recommend social distancing, hand washing, masking, because that's really all we have at the moment. So the part that I worry about with the vaccine is that half of the country is not going to take it, right? You wouldn't believe every year how often I have to argue with patients about getting their flu shots and why they think they shouldn't have it, and why I try to explain that they should. So there are a lot of people that don't believe in vaccines. So even if we get the vaccine, there's going to be a lot of people resistant to taking it. And that's one of the bigger problems.
And we've talked about that a lot because we've done numerous stories about the flu vaccine. We got our flu
shot together.
Yes, we absolutely did. We did.
And you still have people to this day don't deny getting their flu shot. They don't want it. They're afraid of it. They're all of these questions.
So, and I have so many questions for you, and we'll go back to more generic, and I don't mean to call them generic questions, but now I want to focus a little bit about your specialty. You are an OBGYN.
Yep.
So for the women, well, I guess we'll ask the fun question first. Are you guys expecting a huge baby boom?
Pretty much so. Any nice hurricane, the pandemic, those are kind of times where I'm expecting about 9-10 months from now, I'm going to be pretty busy. So, I mean, when people have nothing else to do, babies, and they couldn't necessarily get to their doctor for prevention. So I anticipate we're going to have a big boom.
So are you preparing for that now? Are hospitals preparing for that now? Or is it more of a wait and see?
It's more of a wait and see. I'll be honest with you. Right now, our focus is totally on COVID and how we can make sure patients are safe, the staff is safe, the hospitals are safe, because we want to provide exceptional care.
So for people who are pregnant right now, are there extra precautions that need to be taken? Or if you can ease some people's minds out there?
So, again, and I keep going back to this, but one of my big beliefs is that when you're taking care of patients, if you tell them different things, they lose trust. Okay. And what I think is happening to the American public right now is that they don't trust us, where before you would never second guess what I told you. But when I told you one thing, then we changed it. Now we're going back. We've had this sense of lack of trust. So we need to do better. As far as pregnancy is concerned, in the beginning, they said, we're not so worried about the pregnant women. They're going to be okay. It's not affecting them like the flu would affect them. But the OB in me always said, well, that just can't possibly be true, because the physiological changes of pregnancy are what puts you at risk if you were to get any of these viral illnesses. So I never changed how I felt about it, but we did go back and forth. So they said originally that it was going to affect pregnant women more. Then they said, nope, it's okay. Pregnant women are safe. And now we're back to, nope, pregnant women are at a higher risk. And so I'm going to continue saying pregnant women are at a higher risk, and what can we do to make them better?
Right.
Okay, so the same thing that I would tell you to do: wear your mask, socially distance, wash your hands. And a special caveat to pregnant women is to make sure you go to your prenatal care appointments. When COVID first struck, there was these, we weren't seeing as many patients in the office, we were delaying visits, and the majority of OBGYNs said that might not be the best idea because I need to physically see my patients. I need to check the fetal heart tones. I need to weigh them and do things that I would do at a regular visit. So we're back to now seeing patients full time. And I would implore that these women come in and make sure you're getting your prenatal care, because prevention for the pregnant woman is probably the best route.
Okay, so I have many questions in response to your answer. Okay. Especially for you, because I know a lot of people are doing the telemedicine right now. But for pregnant women, you are saying that they should come in and see their doctor.
I am. I really am. And I'm going against some of my colleagues because, they're not seeing the patients as frequently. I really haven't changed how I'm seeing my OB patients. I have changed how I'm seeing my GYN patients, but the obstetrical patients are ones that you really can't play with. I mean, delaying even a few days puts them at risk of complications. So my group has specifically been keeping up, especially patients in the third trimester, but sometimes even earlier, if they're sick, you need to see them. So go in and see your OBGYN. Don't be scared.
And I was going to ask you that. Do you find that some patients are scared to come into the doctor when they probably really should be coming in to see the doctor?
1,000%. And this goes for not just OBGYN, it goes for all other specialties. People are afraid of COVID. So when this was really bad in the hospitals, in the beginning, the hospitals weren't seeing all the patients coming in for the regular stuff because people were so afraid of going to the hospital, they were afraid of getting sick. So then we reassured them, come to the hospital, we're safe. And I would say that again, the hospitals are doing an excellent job at keeping patients safe, but we need to get them in. We need to see the patients. And it got better, but we're now, because of the increased cases, they're starting to decrease surgeries again. And so where someone might have put off their breast surgery because they had a lump and they delayed it a little bit, it worries me that we're going to have some problems because of that.
You know what? That really concerns me too. And I wanted to talk about that for a moment and then go back to pregnancy. What really worries me is that a lot of women might be delaying their mammograms. And, have you seen that?
I have seen that. And, I think in the height of COVID, some things can be pushed off a little bit, but that's where you need to talk to your doctor, right? I mean, if it's been 4 years and you haven't had your mammogram, that doesn't mean you go in the height of when things are happening because you've waited 4 years, but don't continue to delay. And right now, everything is pretty much open for the moment.
Because say you get your annual mammogram in March, and March was, the height of when everything started to shut down. So you postponed your mammogram. And I can honestly say I usually try to do it around my birthday, and my birthday is in April. So I have not gotten my mammogram yet. And honestly, it's not because I'm fearful of going in. It's my procrastination.
Right.
But it does concern me. I know that I am not fearful to go in to get a mammogram, but people are.
And so I would tell you that a few months delay is not going to hurt you. But if you are symptomatic from something, so let's say, for example, you're having rectal bleeding, okay? That wouldn't be something that I would delay to go to your doctor about, right? So your routine screenings, I think it's reasonable to push a few months, which we have done already. Mm-hmm. But if you're having symptoms, then you definitely need to get in to see your doctor, no matter what those symptoms are.
I want you to talk about that a little bit more in depth. So if you delay your annual checkup or something for a few months, you think that take a deep breath. It's okay. It's only a few months.
I think you can take a deep breath. It's only a few months. And the caveat there is that if you're having a symptom, so, let's use breast, for example. Mm-hmm. If you have some discoloration on your breast or some pain or a lump that you notice, that's not the person I would say to delay, right? But if you have no problems, you had it last year, waiting 3 to 6 months will not cause too much harm. Nothing is 100%, but my medical opinion is that you could delay a little bit and you'll be okay.
Do you think most health professionals are open to seeing patients? Because honestly, I've gotten that question too from people, that some people have come up to me and said that they're worried that their doctor won't even see them unless it's, through telemedicine.
Right.
Yeah.
So there are some practices that aren't seeing full scope yet. But for the most part, and around my colleagues, where they're able to use telemedicine, they are, and where they're not, they're not. And so most doctors are back to work, seeing patients, taking precautions during COVID.
So Dr. Jill, if you don't mind setting the record straight, and this is on the record, right? Because a lot of people, because a lot of people are getting, I think there's a lot of questions from a lot of people out there. Like some people are hearing, and I don't know if it's fair if you can even answer this question. You may not even be able to answer the question, quite frankly. But, we've heard numbers where they say, well, the ERs aren't even full. The doctors, the hospitals are not busy. But then you get other reports saying that the hospitals are busy and there's more patients. I mean, can you touch upon that? Or because I know you have your practice, but I'm in the hospital. You're in the hospital,
right? So let's just start. I have to start with the media, okay? And specifically social media has done an injustice to good information, right? All of a sudden, friends of mine who are attorneys or non-medical people are verbalizing medical opinions, right? I mean,
I don't mean to smile, but right,
I'm sorry. But I would much rather you ask me than my attorney's sister what she feels about masks at the moment. But, everyone seems to be an expert. And, that's really kind of hurt what's happening in the public. So let me set the record straight as of July 15th, 16th,
right, July 15th,
wherever we are.
Yes.
The hospitals are full, okay? And we are in trouble. And so that's why I am saying mask up, wash hands, socially distance, do all of the things you're supposed to do, because the facts that are being put out, the positive tests, are legitimate. Okay?
And hospitals are full with coronavirus patients.
And hospitals are almost full, some on diversion. Do you know what that means?
I don't. Can you please explain it?
So diversion is when your hospital is so full that you can't take any more patients. Okay, and there are a lot of hospitals in this community that are already on diversion. And so other hospitals take up those patients, and we're shuffling people around. But this is not a joke. It is definitely real, and the hospitals do have the patients.
So keep that in. So listen to the experts.
Yeah.
I mean,
stay off social media. I mean, I love social, you know me, I love social media. I love posting videos of my kid jumping her horse and seeing all my friends' kids and all of their successes. But it really shouldn't be the place to discuss medical issues or recommendations. I think we did, like I said earlier in the podcast, we jumbled this in the beginning, right? And now people don't have trust in what we're saying. We have to get that back, right? And so hopefully situations like this and other physicians that are out there advocating, people will start to listen to, because the moment we stop listening to the people that are the experts in the field, we're in trouble. And I'm afraid we're heading in that direction.
You are.
I am, because people are all of a sudden looking at their Facebook experts and going with what they want to hear. So that's the difference. So if someone's putting up there, oh, you don't have to wear a mask, it doesn't make a difference. Well, if you don't want to wear a mask, you're going to listen to the person who's saying not to wear the mask.
Right. You're going to sway to what you want to listen to.
But that's human nature, right? Mm-hmm. And so, but that's not what should be happening. So the CDC, the head of CDC just came out and said, listen, if we all wear masks, we could probably really decrease our spread within the next 1 to 2 months. I totally agree with that. But, right now, I could even argue with you that the CDC hasn't been great at giving out information.
So there's that trust issue.
There is a huge trust issue. And I think that is the root of why we're having such a problem. I mean, people say, oh, it's political, it's this. And I do believe a lot of politics have been injected into this. There's no place for politics in medicine. And we have people that are really sick and at risk we want to do our best to take care of them.
So if people do what they're supposed to do, and if people wear their masks like they're supposed to do, could we potentially get back to normal, or are we ever going to get there, Dr. Jill?
That's such a loaded question because I don't have the answer. And that's part of the problem with what's happening now. I don't have all the answers. And I would consider myself an OBGYN expert. I really don't have all the answers. And I'm okay to admit that I don't have all the answers because this disease is changing. Just 2 days ago, there's a study out of, I think it was France, that there's vertical transmission to the baby, meaning the baby in utero was passed COVID from the mother. Now, it's one case, and I would say emphatically, I don't want my pregnant patients to worry. I think that this is maybe a one-off situation, but what it does to me is say, oh, we need to be cognizant of this. What can I do to decrease the risk of spread?
And I think that's important that you point out that it's one case, but we need to be cognizant.
It's got to be in the back of my mind. I don't want it in the back of my pregnant patient's mind. It needs to be in mine to worry, and then we'll take it from there.
I want to go back to the pregnant women in a minute, but you said something that I want to delve in a little bit deeper. You are an amazing mother to a wonderful daughter, 14 now?
14
now. What about, so my little Sammy, who's 13, she's going to say little Sammy, but she's 13.
Not little.
Not little, but to me, she will always be little. Emma, your Emma will always be. So she is fearful of the virus, very, quite frankly. So how as a mother or a father, how do we ease our children's concerns?
So I would definitely rather take the expert OBGYN questions than the mom questions because I'm not so sure I've got that down pat. But I do think that in my experience with children, that what you put out into the universe is what your child feels. And so if I'm confident and my kid is emulating what I'm doing, I'm going to take the fear away from her. And so our reaction to what's happening around us affects our children. So all of this fighting about whether to go back to school, whether to not go back to school, keep your kids out of that, right? Talk about it amongst your friends, come up with what's best for you and your family. But again, focus positivity on your child because that's what they need to hear and see. I have been called a lot from friends with their children suffering about this. I mean, it is scary for the kids. It's scary for the adults.
Right, and that's why I wanted to ask you. And I think you're giving us great advice. So do not talk about this.
Right. This isn't a conversation with Sammy. This is a conversation with Jill, and you can talk things out and come up with what's best for your family. But she's a child, and you're going to do what's best for her, and don't worry her. Right? You don't want her to feel, now, I mean, that doesn't mean, you can keep everything from your child. No, I'm not saying that. I'm saying the way you react to what's happening around you, your children are going to see, and that's what they're going to feel comfortable or not feel comfortable about.
How much should they know about the virus?
You know what? I prepare them now where there's going to be mask mandates in school. There are a team of physicians in Tampa, Florida, who wrote letters to our governor, and we want masks on our children at school. And so I would prepare them for that. Wearing the mask is not a big deal if it's normal, right? If
Sammy's very good about wearing the mask, I have to say.
So teach them same instructions, and I like that we're going over this a lot, but wear the mask, socially distance, wash your hands frequently, hand sanitizer, just be cautious. And they should know all of that. But they shouldn't see your worry about what you're going to do about school and all of the other things that us moms would worry about with COVID.
So I don't mean to put you on the spot here, but as I have been asking you so many questions. Whatever. But what do you think about school? Do you, and I know, there's a lot of debate out there. I know some schools are pushing back. Gail Guayardo, who is also a former television anchor in this market, she and I were just talking yesterday because in Hillsborough County they have the option of whether to do online or the kids go back. Now in her case, and I know she won't mind me sharing this, her daughters want to go back to school. Her 2 young daughters want to go back to school, so they have decided they're going back to school. They're going to wear masks. How do you feel about kids going back to school?
So let's talk about the facts, right? The American Academy of Pediatrics came out and said, we want kids in school. So it's more than just learning, it's their social growth. There's so many things that play a role with them actually physically going to school. But that being said, I also understand the families that are worried, right? I cannot speak for somebody else's family if, like, for my daughter to go to school, it would be reasonable. I love what her school is doing. They're doing a hybrid type of situation. And I think they're going to have a virtual option, which is great for people that are scared. And obviously, when the virus does hit the school and kids have to be home, we have to be able to take care of those kids. So my answer to your question is going to be vague, and it's definitely person dependent. I cannot speak for another person's family. I can just speak for mine. And the science behind me at the American Academy of Pediatrics is saying send the kids to school. Then as a physician, that's where my head is at.
I also think when you touched upon this as well, emotionally, personally, we have decided to send our daughter back to school as well. For her, I also think emotionally, like they miss
their friends.
Yes, the interaction, right? The social interaction.
And, I've seen arguments back and forth about the social interaction. Well, we're going to keep them distant, so there's not going to really be interaction. But that's not necessarily true. So
because you're still around them.
We're still here. We are 6 feet apart, but I still am enjoying your time. I'm enjoying being with you. And so that argument kind of is something that I don't really agree with.
Thank you for
do what's best for you and your child and your family, because, like I said earlier, everyone's different, right? I'm my childcare issues, right?
Right.
So if Emma was in 6th grade, I certainly couldn't leave her home alone all day when my husband and I are working, and maybe I couldn't afford to have a private tutor at the house with her. So one person's story is not the same as somebody else's story, but the goal should be to get us back to normal life as best we can. And
I think that would be good for the children too. For all of us, it doesn't matter how old you are, for all of us. Okay, speaking of children, you and I talked about, and it was very comforting to me on a personal note, I want you to say that, okay, I've pushed my appointment back, but again, for me, it was not for fear, but it's, my business worries.
Right.
Yeah, and all that stuff, in life. So it's not like you can delay things, but what about the women out there that are contemplating wanting to start a family or having another baby? Would you say hold off for a while, or what is your advice as a doctor?
I wouldn't say hold off at this time. I think that, again, we have to live our life, and this virus is not going away tomorrow. It's going to be here for a while. And so if it is your decision to start a family with your husband or whoever, then start your family. That wouldn't change my feelings from a medical standpoint.
From a medical standpoint. Okay,
and
so
again, precautions.
Yeah. So for people who are starting families and do not have an established OBGYN, I know most women do, but I can tell you in my experience, at this point, when I first moved here, my doctor had decided not to deliver babies anymore. And that's a whole other discussion that you and I can have another podcast about because of the insurances in Florida and, all of that. So if someone needs to choose an OBGYN at this point, or a person, to walk them through this pregnancy and be there, what advice would you have on picking the right doctor for you?
So, everybody's different, and who you may like, I might not like. And so, it's helpful to talk to your friends, right? What have their experiences been? But even then, you have to mesh with the provider that you pick. So I would say that start with talking with your friends and see who they go to and get recommendations that way. And then you might fail you might walk in and say, oh, this is not for me, or this is okay, this was great. It's going to have to be kind of a trial basis.
Or do doctors get offended by that though? Can they tell if a patient is, I only say that it's with pregnancy and with having a baby, it is the most, the biggest moment in your life. Like you don't even realize love until you have a baby, I think, and I know not having a baby is for everybody, but so that doctor, you got to be able to, you need to love that doctor.
You need to love your doctor. And, there are there's so many great doctors in this community specifically. There's great midwives. I think it's just trial and error. And remember, so now some of the groups have people that aren't in their group delivering their babies for them. So you don't necessarily always get the doctor that you wanted. So like if you came to see me, I couldn't 1000% guarantee that I would be there the night. Like I was on call all last night. You wouldn't want me to come in tonight and deliver your baby. Right. And
it's a very good, you're tired.
Tired
I know those, I know. Right.
So, what we do as a group is try to have patients see a bunch of the different providers so that they get a feel, so that you at least have seen my face before I walk in. I'm like, hey, we're having a baby today. And, it just, you got to do your best.
You're awesome, Dr. Jill. So in closing, the masks, wear the masks.
Wear the masks.
Sanitize, which is a great habit anyway. I mean, coronavirus or no coronavirus, I mean, it's a great habit to wash your hands.
Right. It'll be interesting for me to see what happens during flu season this year. My bet is that we're going to have less flu cases this year, not because we're overrun by COVID, but we're taking all of these precautions. And so the same precautions we would take for COVID, we're going to help prevent the flu.
There you go. Well, I would love to invite you back on. Let's talk about this again in a few months and take a look at what's happening, because you don't think this is going away anytime soon, do you?
I don't. Let me just say one other thing.
Sure, absolutely.
What I want to make sure people hear is that the hospitals are ready for you. And, there have been, over the last few months, there was a couple of issues where patients were choosing home birth versus coming to the hospital because they were afraid of getting the disease. And other scenarios like you could only have one person in the delivery room with you. My response to everyone is that please go see your doctor, make sure you get your prenatal visits, and don't be afraid to be at the hospital, because they are taking the precautions needed to make sure that you're safe. And I happen to be on staff at pretty much every hospital in this city. I know what they're doing to keep their patients safe. It is a safe place to be.
So I can't let you go until you answer this question, though, because
I open a can of worms.
Because it really piqued my curiosity. So when someone does deliver a baby, who can be in the room when you're delivering? Can your husband or your partner be in the room anymore?
Yes. So in Tampa, Florida, we are allowed, and pretty much across the country, because in New York, they had stopped letting visitors, period, come into the hospital. And most OBGYNs were very against that, because you need an advocate, right? When you go to have a baby, I mean, just think about it. After you deliver, the next day, you're not feeling 100%. Can you imagine having to take care of a baby by yourself?
No, not at all.
You need your partner. You need your mom. You need somebody there to help you. So the hospitals are allowing one visitor. Okay. And we're masking all of our visitors, and we're taking precautions in situations where patients are sick. So if they are COVID positive and sick, things are a little bit different. We're still allowing visitors, and it's really kind of hospital dependent, but it's a little bit more challenging in that scenario. So I can't honestly say, like, someone might come in and say, all right, no visitors. She's too sick for visitors. We need to keep her isolated. That's possible, but for everybody else, you're at least allowed one. And, it's been great. We're FaceTiming, right?
It's wonderful to I have to say, we've told our kids forever, stay off.
Yeah.
But at least thank goodness now for FaceTime and, the interaction.
I did it with my military families for years, right? If dad is in Iraq or somewhere else, we held up the iPad and dad got to witness his baby's birth. And so we're still doing that. So everyone can still be involved. Just look at things a little bit differently. And the nurses and I were just recently talking about this. It turns out it's kind of nice having one person in the room, right? It's quieter. It's more intimate, right? Even if it's your mom, right? It's such an intimate moment to give birth, and it's not taken away by your two aunties in the background, yay, but screaming. So it kind of, what we thought we were worried about by limiting the visitors has turned into, or maybe we're just looking at it with the glass half full, a much more intimate birth experience.
And I think, we should always look at the glass half full.
Oh, 100%.
Right. Instead of focusing on the doom and gloom, let's look at the glass half full. We have professionals like yourself working around the clock.
Right. Tired professionals working around the clock.
But you look fantastic.
Thank you.
And they're to protect us. Right. Listen to the bottom line. Listen to your doctor. Don't pay attention
to your expert social media friends that feel like they know what to do with masking, and take the politics out of it.
Absolutely.
Right? And all of those things just lead to negativity.
Well, Dr. Jill, we loved having you on the podcast, but I want you back in a few months, and let's talk about this again. And then definitely when the baby boom happens. I'm not going to
be able to walk in here when the baby boom happens.
I don't mean to drop this, though, at the very end of the podcast. What I realized doing a story with my One Blood partners that we've been doing stories on convalescent plasma.
Which is awesome.
Thank you. We'd love to talk.
I'm a huge fan of that.
We'll have to do a whole separate podcast on that. I would love to have you back on again. But I didn't realize the graduating class of 2020 are also the 9/11 babies. A lot of them, right? Their moms were pregnant during 9/11.
Ooh, you just gave me the chills.
I know that happened to me. Like, listen, I did not realize that. I did not realize that either. So many of those moms were pregnant during 9/11, and now their daughters and their sons are graduating. Yeah, so we are actually having some guests on the podcast to talk about that.
I feel like 2020 needs a little reset button. We need to fix it. Boom. Let's start this again because this has not been very fun.
I agree. I absolutely agree. Well, thank
positive
you.
Attitude.
Positive attitude.
And remember, that's going to affect your children and just the people around you. I mean, there were some dark times at the hospital when, everyone's scared, and there were some dark times, and the people that were the most positive really kind of infected all the others in a positive way, and we got through the hard times, and might be having another cycle upwards, but we'll get through this as well, and the more energy positive that you can send off, the better.
Thank you so much, Dr. Jill.
Thanks for having me.
We so appreciate it. In closing, I always say, paraphrasing one of my favorite poets, Ralph Waldo Emerson, go where there is no path and leave a trail. Thanks so much for listening, everybody.